Hi, today I'm bringing you a quick fix for a migraine. Today I'm bringing you an interesting case. First, because migraines is something that we see a lot in our clinics, but also because it was a different case than usual. This was a case where I had to work in a very quick way. And why is that? Well, this was a patient that I've already been following for quite some time. She started suffering from very frequent and very strong migraines that are more or less controlled, but that week she happened to have a migraine, a very strong migraine, that happened during a period where we did not have any appointments for the near future. She's only doing one session a month, and this happened in between the sessions. So she was very far from the next session. It was a long time to wait, but she called me to see if I could find an opening in my schedule to see her, because her migraine had started and it was getting worse and worse by the minute. But the problem was I was actually traveling to teach a course that week, so my schedule was completely full. But I didn't want to leave her without treatment. I wanted to help her, so I told her to come to the clinic and that I'd find a solution. I didn't even have a treatment room open for her or the time to do a full session. I only had about 15 minutes to work with her, and she had to be sitting down in a spare room that I have because I didn't even have a treatment bed available for her. So I did the best with what I had, and when she arrived at the clinic, I asked her how she was, how was the headache, and she told me that she was already suffering from the migraine for about a day and a half, and at that point it was very strong. It was mainly on her right side. It was frontal and also a little bit behind the eye, and she was very sensitive to light, and the pain was about a 7-8 out of 10. If you like this kind of content and you want to learn more about the techniques I show in my videos, check out the courses I have available. The links are in the description. I have courses available in Portuguese and also in English. So I sat her down, and the first thing I did was bleeding the ear apex on both sides. The ear apex is an amazing solution for most problems regarding the head. It's actually a very versatile point, so if you'd like to learn more about applications for bleeding the ear apex, let me know in the comments and I'll make a video specifically about that. But in this case, it's great to remove the excess, because this was a lot of yang rising to her head. So I bled both the apexes, and after just a few seconds she told me that she felt like there was a balloon inside her head that was letting out the air and the pressure was coming down. There was still a lot of pain on the frontal area, mainly on the right side, so in the path of the yang ming. So I went on her right foot because I wanted to do bloodletting, and when I do bloodletting I always use the same side as the pain and looked at the area of 6605. This is a great Master Tung point for Yang Ming type headaches. It's in the image of the head, it's on the stomach, and it's close to stomach 43, so it also works as a guiding needle. I bled this area. There were no visible blood vessels, so I just used this pen like you can see here, and I did 3 or 4 pricks around the area of the point, and I squeezed them to get a few drops of blood. After I've done that, she told me that most of the pain was gone, and now the only thing she had was pain and pressure behind her eye. In these situations when the pain is in the area of the eye, particularly behind the eye, I like to use the liver to treat it. So I did exactly the same thing that I did in 6605, but in the area of liver 3. Again, this is on the image of the head, and it works as a guiding needle to treat the liver channel on that side. Right then and there, the patient told me that the pain was way down. She was still not feeling normal, but it was almost no pain. The only situation where she could get the pain to come back was when she lowered her head, like putting her head between her legs. Then she would feel the pressure coming back and the pain coming back. But if she was still, there was no more pain. So I let the patient sitting down in the dark room for about 15 minutes, and then I came back because, as I told you, I didn't have any more time. When I came back, I asked the patient how she was feeling, and she told me that the pain was completely gone. She came out of the room. She could now tolerate light. When she was in the daylight, she told me that, well, it was still bothering her eyes a little bit, but not any kind of real pain. So I let her go like that, and I called her the next day, and she told me that a few hours after the session, all the pain was completely gone and the migraine was solved. This is a very interesting case because it shows us first how quickly acupuncture can solve a crisis like this. And this patient, even with strong medication, couldn't get these quick results. Before she started acupuncture, even using a lot of medication, when she started having a migraine crisis, it always lasted a few days. And as you saw in this case, in a few minutes we could solve the crisis. And the key for this treatment are actually two secrets. One is knowing the images and the points that balance the area of the head, but the other one is the usage of bloodletting techniques. I've talked about bloodletting in more than a few videos already, and this is an amazing technique, especially if you want quick results. So for cases like this, I always advise for you to start with bloodletting, because you will see a lot of improvements in your... If you're an acupuncturist and you don't work with bloodletting, you should study it because it is a very important tool. Thank you so much for watching. If you liked it, don't forget to like and subscribe and share this video with anyone that might benefit from it, and I'll see you in the next one.